Alright, this is Rowan Shea. I'm going to use my child as an adult for this to demonstrate the assessment skills. I'm going to first start out by asking you, Rowan, have you ever experienced any chest pain or feel like your heart's skipping or shortness of breath?
No.
Alright, and we'll continue on with the rest of the questions. Rowan, do you have any family history of heart disease or lung disease?
No.
Alright. Do you smoke?
No.
Okay. Now that we know those things, we'll go ahead and start the physical assessment. First thing we're going to look at is a visual inspection. We'll check his chest for any asymmetry when he takes a breath. We'll look for any spots on his chest or abdomen that pulsates, which could indicate an aneurysm. After we do a visual inspection, I'm going to check his trachea, make sure it's midline. It is in fact midline and it is movable. Don't smile too much, Ron, you make it too cute. Then I'm going to check his lymph nodes. I'm going to check here with the cervical limb. Nothing standing out, nothing inflamed. I'm going to check here. Check for his adenoids or his tonsils. Nothing swollen. No enlarged lymph nodes. I'm going to now feel his carotid. There's a good strong pulse on his left side. There's a good strong pulse on his right side. I'm going to now check his radial pulses. It's a strong right radial pulse. It's a strong left radial pulse. I usually go for the pedal pulses. He has strong pedal pulses, which tells me that he has good blood circulation. Now I'm going to listen to his heart. I'm going to start with the larger diaphragm. Listen for the S1, S2. Start with the second intercostal space, the right sternal border. Listen for the apex of the heart. Now I'm going to start with the fifth intercostal space, mid-clavicle. Check for the base of the heart. Check for S1 and S2 sounds, both present and accountable for. Now I'm going to switch over to the bell of my stethoscope and see if I hear any murmurs. No murmurs heard. I'm going to put my stethoscope on the set of carotid for any bruits. No bruits. Alright. Now I'm going to have Rowan sit up a little bit. I'm going to listen to his lung sounds. It is easiest to assess the apex of the lungs from the dorsal side. Can you take a deep breath for me, Rowan? Deep breath. Apex of the lungs sound clear. Right side has the extra lobe. Take a deep breath. Check the base of his lungs. Take a deep breath. And more time, sure. All long fields sound clear. You can sit back for me, Rowan. I'm going to listen to your trachea and your bronchi. If you can take a deep breath for me. Everything sounds clear, no unusual turbulent sounds. Now, I'm not very good at this, but I'm going to attempt percussion on them. If you'll lean up for me, Rowan. Is good resonance. No dull sounds in the front. No dull sounds in the rear. Go ahead and lean back for me. Check his front. No dull sounds there. This tells me that there's no fluid in his lungs. He's clear. There's no fibrotic tissues in his lung area. Now that I have assessed his cardiac, done the cardiac assessment, checked his heart, didn't notice any S3, S4, didn't notice any friction rubs, noticed an S1, S2 in a normal capacity, no inflamed lymphs in the cervical area, all lung fields sound clear. I'm going to check again for turgor. It's great turgor. I'm going to check his capillary refill. Refills in less than 2 seconds. Again, this just goes to show that he has great circulation throughout his body. Alright. So we checked his heart, we checked his lungs. And when we did the inspection in the skin, we didn't notice any cyanosis, no redness, seems well oxygenated. Bronchioles sounded clear. Looking at his chest, we can see that the latitudinal circumference or diameter is greater than the anterior posterior, so he's not barrel chested. He's not pigeon chested. His sternum doesn't protrude at the bottom. Anatomically, everything seems normal. Now, it's going to be difficult with a child, but we're going to do the jugular venous pressure. So Rowan, I'm going to have Rowan lay back. This recliner kind of gives me the 30-degree angle. I'm going to take a pillow. Rowan, if you lift up your head for me and put it behind his head. So he is not using the sternomastoid muscles. Sure, we'll probably not use the pillow on Rowan. And I'm going to look for the pulsation in his jugular veins. I'll go ahead and relax for me. I'm going to find the point highest. Measure it from his sternum. Make sure sternum is level. He is less than 1 centimeter, which is normal. 3 to 4 would show abnormality. And that's all I have for my video. Thank you, Rowan.